Hi everyone, I want to talk about spinal cord injury complications. Spinal cord injury complications. Okay, let's go. When there is spinal cord injury, renal system will suffer the most. I have made a separate presentation on autonomic dysreflexia. Kindly check my channel to get that. And then let's go. Urinary tract infection, that is the commonest source of sepsis in individuals with spinal cord injury. 15 to 20% would die as a result of this, and more in women than in men, because it's obvious, even without spinal cord injury, more women will come down with urinary tract infection more than men. Indwelling catheterization will increase the risk, and there will be fever, autonomic dysreflexia, increased spasticity, foul-smelling urine, incontinence, frequency, dysuria are symptoms. The treatment here will be with antibiotics. Also, there's possibility of kidney stones that could be found in the kidney, ureter, and bladder. The risk factors that could be associated here will be indwelling catheterization, urinary tract infections, mobilization, and hypercalciuria. Still talking about urinary system as per spinal cord injury, there is an entity called autonomic dysreflexia. I alluded to that in a while ago. So you can check my channel for the separate presentation on autonomic dysreflexia. There's possibility of vesico ureteral reflux leading to repeated urinary tract infection and pyelonephritis. And renal failure could be found from all the above presentations or conditions that will be seen or likely to be seen in individuals with spinal cord injury. Spinal cord injury could lead to bladder dysfunction. And the bladder dysfunction here is as a result of the control from cerebral cortex, pontine, sacral micturition centers, and peripheral nervous system. But there will be no sensation of the bladder fullness, and sphincter function could be impaired as well. Muscle control of bladder is lost in spinal cord injury. Remember, I've just listed that when bladder is working very well, all the centers involved will be cerebral cortex, the pontine, sacral micturition centers, and peripheral nervous system. So that is no longer fully coordinated when spinal cord is injured. Then there is possibility of bladder flaccidity, detrusor sphincter dysnergia, and sphincter hyperactivity, which can impair complete emptying of the bladder. How do we get the individuals with renal problems treated in the face of spinal cord injury? The first thing to consider is making a clean intermittent catheterization. Okay, then we can use medication like oxybutynin or tetraridine. When we use either of them, we're going to get results that will decrease the tone, decrease contractions, decrease urinary frequency, and decrease incontinence. Also, we can use tricyclic antidepressant that will retain urine, or ephedrine that will increase the storage, and betanicol in phase of hypotonic bladder. Alpha blockers will relax the sphincter, decrease bladder pressure, decrease sphincter dysnergia, and prevent abnormal contractions. Respiratory system is not immune when it comes to spinal cord injury. If the injury is involving cervical and thoracic region, there's likely going to be decreased respiratory muscle strength and, of course, respiratory failure, and that could lead to death. There will be impaired cough reflex and can't mobilize secretions. Then, with that, there will be increased rate of pneumonia. Deep vein thrombosis with embolism will later progress to pulmonary embolism. And in a matter of hours, within 72 hours of onset of pulmonary embolism, if it is massive, the affected individual could pass on. The treatment here will involve chest physiotherapy, vaccination, DVT prophylaxis, and chest x-ray to find out whatever is going on along the respiratory tract system. Also, coronary artery disease is a possible complication when it comes to cardiovascular system and spinal cord injury. You can check my videos on heart attack. I have about 5 of them. So with that in place, I'm not going to go over details of coronary artery disease here because it's very lengthy. Just check, or let me kindly say, please just check my channel for coronary artery disease videos, 5 of them. I think about 6 actually. The lesions above T5 will lead to decreased typical chest pain of myocardial infarction or myocardial ischemia. And with that, an individual with spinal cord injury involving lesions above T5 will likely have atypical presentation of coronary artery disease. So they may be having myocardial infarction or myocardial ischemia, but they will not be able to tell that they have pain. So you can just carry out your serial enzyme assay, cardiac enzyme assay, and do your EKG and auscultate, do other physical examination to arrive at your diagnosis. Anyone with spinal cord injury, there's likelihood of decreased life expectancy. Deaths are common in the first year post-injury, but after that 1 year, 90% might still die, but they will die like just anyone else. Okay, longevity depends on severity of the injury, and if the injury is occurring in an older people, is likely going to contribute to early death. And if it is occurring with higher neural level, then early death is going to be higher also. The causes of death in individuals with spinal cord injury will include respiratory failure, respiratory diseases, like I said, repeated pneumonia, and I've said with DVT, they can have pulmonary embolism, leading to respiratory failure and death. Cardiovascular diseases or complications, I've just said that they could come down with atypical presentation of myocardial infarction or myocardial ischemia because they may not experience pain depending on the level of injury. Untreated urinary tract infection with sepsis might be the culprit, and that could be common in elderly where they will not present with fever as may be expected. Okay, with that, I've come to the end of the presentation on spinal cord injury and the associated complications. Kindly subscribe to my channel so that you can get my presentations immediately they are published. Thank you.